Good. So the next one we'll be looking at is teaching milestones in a toddler. Teaching milestones in a toddler. In this particular case, you're an FY2 in pediatric department. Susie is a fifth-year medical student who wants to learn how to perform a toddler development assessment. Teach a student how to perform development assessment in a toddler. This particular student has been posted for 6 weeks in a pediatric rotation. And so far, he or she has been in this rotation only for the past 1 week and would like to learn how to perform a toddler's developmental assessment. Approach to the task, as usual, is a teaching approach. Introduction, use your first name. My name is Samson, I'm one of the FY2s. Develop a rapport, ask only one of the questions. How is the rotation going at the moment? It's clearly is in pediatrics because an FY2, peds. So how is the rotation going at the moment? Introduce the topic. I understand you want to learn how to perform milestone assessment in a toddler. Yes. Is there anything specific you would like to learn? Check prior understanding. So what do you know already about milestone assessment? Explain indications. So we usually perform milestone assessment in a child or a toddler, anybody. What are the indications for routine assessment or concerns from the parent? It is a routine assessment or concern from the parent. Now, generally, let's start with an approach. Generally, toddler usually is the years 2 to 3 years. Yeah, it's the age 2 to 3 years. That's what we call toddler. Okay. How old is the child you want to learn to perform an assessment? Okay, is it 3 years of age? Okay, so let's start an approach. So generally, what do you look for? You look for 4 areas: the gross motor, the fine motor and the vision, hearing and language, and the social. There are 4 main areas: gross motor, fine motor and the vision, hearing and language, and the social. Yeah, this is just supposed to be language, not languages. They're not going to speak in languages. Yeah. Here we go. So there are the 4 areas to look at. Let me go back. Yeah. Good. So let's start with the gross motor in a toddler. Again, we say toddler 2 to 3 years. So we're just going to focus 2 to 3 years. At 2 years, you should be able to run. Should be able to run around. 2 years old child. At 3 years, they should be able to stand on 1 foot or climb on 1 foot per stair. Go the stair 1 foot at a time. Okay. Good. So that's roughly. So things you might need to know roughly, but it's difficult to memorize or to remember. Of course, you need to check these things. Yeah. At the time of assessment, you should be able to check. Good. What about the fine motor? At the age of 2 years, they should be making circles. Yeah. Draw circles, draw lines, scribble around. So fine motor, the use of the fingers. 3 years, they should be able to build bridges with blocks or draw circles properly. Okay. Good. What else? Hearing and language. What can they do at 2 years? Yeah. Should be able to use 2 words phrases. 2 words phrases. Yeah. And at 3 years, they should be able to make some short sentences. They should know colors. Yeah. Knows colors at the age of 3 years. Yeah. So roughly have some idea what they can do at this age. Okay. Good. What about the social? Social wise, they should know their identity, like know their name. They should be able to do parallel play. Parallel play means somebody else is playing here. They should also play on their own. Yeah. And then at 3 years, they should do an interactive play, playing with somebody. Yeah. So that is in terms of the social. Okay. Good. So this is what a child would expect in a toddler 2 to 3 years. Okay. So let's recap that again very quickly. Gross motor, they should be able to run at 2 years. Stand on 1 foot or climb on 1 foot per stair at the age of 3. Okay. Fine motor, make circles, lines, or scribble at 2 years. 3 years, they should be able to build bridges with blocks and draw circles properly. Okay. Social, yeah. At 2 years, they should know their name or their identity, be able to play parallel, okay, which means playing on their own where somebody's doing his own task or play on their own. Okay, 3 years, they should be able to do interactive play, playing something, a game with somebody. Okay, good. Now, what is important when you're assessing a child is to be able to pick up the red flags. What's important is to be able to pick up the red flags. So this is what you need to know. So you can see that something is wrong, and then you can refer them for assessment. So what can raise what could be the red flags of development at 2 years. At 2 years, from the language point of view, if he's not able to follow simple commands, okay, like sit down or come here, simple commands, okay? Lack of words or lack of 2 words meaningful sentences, either no words at all or cannot make 2 words sentences meaningful, okay? That can raise the concerns at 2 years. Motor-wise, inability to walk. If they can't walk at 2 years, then there's a problem. Social-wise, poor eye contact. They can't maintain an eye contact properly. Okay. Okay. Not imitating actions on words. Okay. Or words of the caregiver. Yeah. This is all here. Yeah. Not imitating. You say something, they copy you. Yeah. So not copying some actions or words. Yeah. Of the caregiver. That can also raise some alarm. Yeah. Now, at 3 years, what should raise the red flags, or what should be a red flag for? Language, inability to use the 3-word sentences. If they can't do that at 3 years, of course, it's a concern. Motor-wise, difficulty using stairs or frequent falling. That may suggest, again, a problem at 3 years. If they can't use the stairs or they're frequently falling, it may suggest things like what? Duchenne muscular dystrophy. Social-wise, lack of pretend play. They should be able to do a pretend play. Okay, so these are the red flags. Now, how else you assess a child? You need to use the growth chart, where you have to assess their body mass index, to see how they're developing, their weight, their height, the head circumference. You use a growth chart. This will give you center location of the child development. Okay, center location of the child development. And of course, you ask you, where can I read more? A student may ask, where can I read more? After every teaching, you suggest them to read more about the topic somewhere. Where can I read more? Where the Royal College of Pediatrics and Child Health, you can read more about this. Similarly, like we did teaching suspected cancer in the other scenario, they can read up more on NICE guidelines. Okay. Even here, NICE guidelines will also give this. So they can read up more on the NICE guidelines. They can read up more on Royal College of Pediatrics and the Child Health website. Thank you.